Okay, can you see the screen?
Yes, sir. We can see the screen.
Again, thank you. Uh, this is the outline of my presentation. I'm going to start with a few personal comments that I think have relevancy to the issues that we're talking about. First of all, I'd like to welcome everybody. Thank you for participating in this workshop. And again, as I said, I want to give a little bit more background that I think has some useful insights. I have degrees in geology and a PhD in chemistry. I started my career about 61 years ago as a technician, a physical science technician with the U.S. Geological Survey. I worked while taking courses, and the class material that I studied uh, made my work more meaningful. And the topics that I was working on at the USGS enhanced my contributions. The topics I studied, I should say, enhanced my contributions to my work. Uh, Important point that I want to make that is that as a scientist, you almost never solve a problem. You make progress. You build on a framework for other scientists and future researchers to continue to build on. If you are lucky, you return to the problem with new insights and skills and add to the framework that you and others have created. In the early 1970s, while I was a principal investigator of the Apollo 14 lunar sample, a high school student introduced me to uncontrolled coal fires. I recognized the importance of this issue and ultimately spent several years in the 1980s characterizing the minerals forming around these gas vents from the underground coal fires. In 2019, I returned to this issue in the Jharia region of India, working with colleagues at the Birla Institute of Technology. And once again, I was able to build on the work that I had done some 40 years earlier. The work on the uncontrolled coal fires led me to look at the source of elements being mobilized by the fires, and primarily the coal that was burning. For the next 30, 50 years, I investigated the inorganic geochemistry of coals. In 1996, on a trip to Guizhou province, China, I was introduced to the devastating health impacts caused by residential use of coals that had been enriched in arsenic, fluorine, mercury, selenium. This experience led me to work with my colleagues and friend Ule Salinas, who unfortunately has recently passed away, and Jose Centeno, who you will be hearing from, I believe, tomorrow, to establish the field of medical geology. I quickly realized that because this is a multidisciplinary field, I had to communicate with people other than the lunar scientists, the mineralogists, the coal scientists that I had been talking to. The success of medical geology, to succeed, I should say, in medical geology, I had to learn to communicate with people outside my areas of comfort. And this is the focus of today's workshop. So I've done the personal introduction. I have some preliminary remarks, and then we'll continue. And at the end, I certainly welcome your questions and comments. Medical geology is a multidisciplinary field requiring that we interact with people from several other disciplines. To be effective, we must clearly communicate our thoughts. This does not require that we learn a different scientific language. Rather, we have to simply speak in a way that others understand what we're talking about. And this is the essence of today's workshop. Let me start. Hopefully, all of you are familiar with the definition of medical geology. It is the impacts of geologic materials, geologic processes on plant, animal, and human health. And medical geology, this field of science, is sometimes referred to as geology and health, geomedicine, or med-geo. What do medical geologists do? Well, we team with the public health biomedical researchers to help find solutions for existing medical geology problems. And if we're teaming with these people, we need to communicate with them. We use geoscience techniques and data to identify potential medical geology problems. We investigate the health benefits of geologic materials and processes. And we help reassure the public when there are no legitimate medical geology issues. We need to educate them. And again, we need to communicate to the public in ways that they can understand, in words that they're comfortable with. We saw a very similar diagram earlier today. Medical geology, in essence, is at the juncture of geology, public health, environmental science, but because it deals with not only the geologic environment, but with the health of people, it brings in a number of other social sciences and hard sciences: geography, epidemiology, toxicology, pathology, chemistry, biology, social science, economics, climatology, engineering, politics. If we want to be effective in relaying our scientific results, we need to communicate with a wide range of people from different disciplines, as well as the public. These are the issues that we deal with: naturally occurring dust, minerals, metals, trace elements, organic compounds, radionuclides. And we also are very much concerned with the geologic processes, the processes that act on these materials, concentrating them, altering them, combining them, and most importantly, bringing these materials into contact with communities, with people. We saw this earlier. It's, I think, a very effective diagram that shows geologic materials at the core. They're mobilized by both natural mobilization, wind, volcanic eruptions, landslides, as well as anthropogenic mobilization, mining, construction. And the materials, once they're mobilized, end up in the hydrosphere, the atmosphere, and in soils and sediments, which in turn impact the agriculture, water resources, livestock, fisheries, and ultimately impacting the health of people and animals. I often start my lectures with this X-ray. It's an X-ray of my body. A number of years ago, I thought I had a sports injury. I might have broken a rib. I took the day off from work to go to the dentist at first and then the doctor. When the doctor took the X-ray, he came running out and said, "Did you eat barium?" I said, "No, I didn't eat any barium." I said, "Why?" He says, "Notice in your stomach are all these opaque particles." He says, "What could they be?" And then I realized that it, I had gone to the dentist previously, and the dentist removed one of my fillings in my teeth. And this was a number of years ago. The fillings were quite old. It was mercury fillings. It was mercury that showed up on the x-ray. And I use this x-ray to make several important points. First of all, the speciation. If that mercury that I had ingested was methyl mercury rather than the mercury nickel amalgam that the fillings are made of, I probably would have been dead. I also use this to demonstrate or illustrate the importance not only of speciation, but of dose. Uh, this small amount of methyl mercury could have been deadly, and the route of exposure. If I had inhaled the methyl mercury, I would have died. But ingesting this inert methyl mercury nickel compound, I was relatively safe. When I initially showed this in a talk that I gave, there was a doctor in the audience, and he came up to me after my talk and he said, "How long were you standing on your head when they took the x-ray?" And I said, I don't understand what you mean. He said, the film is upside down. He said, your head is at the bottom, your feet is at the top. I, of course, as a geologist, didn't recognize that. But the important point is I leave this film in this upside down frame to illustrate the importance of collaboration. You need collaboration with the other scientific communities, with public health, the medical communities. Otherwise, you could be left standing on your head, making fundamental mistakes about human health. One of the objectives of this series of student conferences is to provide student researchers with an opportunity to get more comfortable making oral presentations. And many of the students today did a fine job. After getting over your initial jitters, nervousness, we commonly find comfort in speaking to audience consisting of our peers. Unfortunately, this limits our ability to reach outside of our comfort zone, and it restricts us from reaching larger audiences that may be able to help advance our research or to use it to help the public. In this workshop, I will offer advice to earth scientists, environmental scientists, chemists on how to better communicate with public health and medical researchers. First of all, we need to be proactive. We need to seek out opportunities to reach other audiences, and sometimes only a few words can make a big difference. A number of years ago, I realized that I had been speaking to the initiated. Almost all of my presentations were to geologic audiences, to the Geological Society of America conferences, to local Geologic Society present office, to medical geology conferences around the world. But I was speaking to the same people, the people who were conducting similar work. At that point, I found an announcement saying that the Texas Public Health Association was having their annual meeting only a few minutes drive from my house. And I decided it was time for me to take a chance and to speak with a different audience, an audience that I wasn't uh, familiar with or comfortable with. I submitted an abstract and it was accepted. When I got up to give my talk, I said four words that weren't in my script that made a huge difference. And those four words were, I need your help. You are the people in the audience were the people I needed to help translate my geochemical observations to the public health aspects. And at the end of my talk, four people approached me to discuss potential interactions. And one of the people that came up, I ended up collaborating with for several years. But those four words also made a big difference. I need your help, because a week or two after the conference, I received this plaque for the outstanding research paper presentation at the conference. So as I demonstrated, being respectful to these audiences can really have a positive impact. So shared vocabulary. The more terms that you know, the more effective that you can be. Remember, geologists are not medical scientists. Public health scientists and physicians are not geologists. I had the good fortune of collaborating with my good friend, Jose Centeno, who you will hear from tomorrow. Jose's toxicologist, pathologist, and Jose taught me the terms to use, and he picked up many geologic terms and very proficient in communicating with geoscience audiences. And this, of course, it's a two-way street. We have to communicate to the public health community, and they have to communicate to us. And as I say, it's really a multi-street intersection, because we deal with chemists, statisticians, hydrologists, environmentalists, and we need to be able to communicate with them effectively. When early on collaboration, Jose, who was with the Armed Forces Institute of Pathology, and we agreed we should get together, our colleagues together, who were working on complementary research projects. So Jose and I organized a conference, and 6 or 7 of his colleagues from the Armed Forces Institute of Pathology gave presentations on what they considered medical geology. I had 5 or 6 of my USGS colleagues talk about medical geology. It was an unmitigated disaster. What happened was the pathologists at the Armed Forces Institute of Pathology wanted to impress the geologists, and the geologists wanted to impress the pathologists. So they spoke not to each other, they spoke at each other, using phrases, using terms that neither side understood. Jose and I, after this disaster, we realized what had to change. And we organized a second conference. But in this conference, we told our colleagues to dumb it down, to talk at the conference as if you were speaking to management. Use simple words to convey your thoughts. And we got the Environmental Protection Agency to join us, and it was a much, much more effective conference and resulted in collaborations. We, of course, have to acknowledge that we don't know all of the details, and uh, even in our own field. But acknowledging that to the audience, I think, gives more credence, more credibility to what we're doing. And as I pointed out, be respectful. Recognize that your audience, if you're speaking, if a geoscientist speaking to a public health conference, they've got knowledge, they've got uh, information that can be valuable. What are the sources? How do we learn these terms? Well, there's certainly introductory texts, there's medical dictionaries, introductory college courses, glossaries, just a few examples. I took this course in pathophysiology, and it had a large glossary of public health biomedical terms. Obviously, not all of them are necessary, but it helped me when I heard a term that I didn't understand. I was able to resort to this glossary to explain the, and of course in medical geology, our book on practical applications of medical geology has an extensive glossary on not only geologic terms but public health terms as well. In addition to conducting research, our primary responsibility is to educate, leading to prevention. Audiences include local populations and their leaders and government officials, nonprofit organizations, public health community, and the public. We need to talk to them in terms that they can understand. As I mentioned, 1996, when I first was exposed to this concept that geologic materials impacted human health. In Guizhou province, I met people who, as I said, were impacted by burning coal with high arsenic and mercury and selenium and fluorine. This gentleman, as you can see on his torso, has hyperkeratosis. There's a black dot over his left breast. That's Bowen's disease. He had squamous cell carcinoma. I asked, if, obviously through a translator, I asked him if he understood that burning the coal was causing these health problems. And he responded saying, of course, he understood that. He knew the coal was dangerous to his health. But his comment to me was, what choice do I have? If I don't burn the coal, I'll starve or freeze to death in the winter. So I choose a slow death rather than a quick death. This changed my attitude. I understood that we had to look for practical solutions to these problems. We had to find ways to work with these people and come up with solutions that they could implement to avoid or reduce the health problems caused by the geologic materials they're exposed to. We also need to talk to administrators and funding sources to support our work. For this, we need yet another non-technical vocabulary. We must be able to communicate to the administrators, to managers, to the funding organizations, the importance of our work. So why is medical geology important? Medical geology issues, health issues, can impact the people in villages and in modern cities. Medical geology issues impact hundreds of millions of people in every corner of the globe. And I'll amplify on this. There's a broad range of medical geology issues caused by inhalation, ingestion of food and water, and even dermal contact. Medical geology issues can be due to excess exposure or deficiency of essential elements. Medical geology issues can impact many occupations, such as mining, farming, construction workers, potters, gas and oil production, and many other occupations. It's important to emphasize how many people are impacted by medical geology issues, often far exceeding the more common health issues caused by microbes. Arsenic exposure, hundreds of millions of people around the world. We heard earlier 50 million people in India alone, in Bangladesh, in China, Mexico, North America, South America, silicosis, pneumoconiosis, coal workers, pneumoconiosis, black lung disease, hundreds of millions of people. Silicosis is the largest health problem, workers' problem in China. Tens of millions of people there alone. Fluorine excess and deficiency, tens of millions of people around the world. Volcanic ash and gas affects tens of millions of people. Selenium deficiency, iodine deficiency, geophagia, eating soils, water quality issues, hundreds of thousands of people. As you can see, probably in the order of 1 billion people around the world, health is impacted by what we consider to be medical geology issues. Medical geology has an important role in helping to minimize or prevent environmental health problems. Medical geology is a discipline that has the potential for saving lives and preventing costly, debilitating disease. Earliest writings of our great civilizations, Chinese, Egyptians, Indian writings, Islam, and others, drew attention to these problems and benefits of the natural environment. So these issues have been known for thousands of years. But now, orders of magnitude, more people are suffering from these problems than were suffering at the time of the great civilizations recognizing these issues. Although medical geology health problems are not communicative, they're not transferred from person to person, education, awareness, training can substantially reduce healthcare costs, increase productivity, and save lives. And these are examples of medical geology issues. I'm sure you're all familiar with exposure to harmful elements, arsenic, lead, mercury, selenium, fluorine, thallium, chromium-6. Deficiency of fluorine, selenium, iodine, iron affects hundreds of millions of people. Exposure to quartz, asbestos, aragonite, pyrite also impacts hundreds of millions of people around the world. Exposure to carbon dioxide, methane, sulfur, fluorine, chlorine, naturally occurring radionuclides, uranium, thorium, radon, organic compounds. That's an issue that I'm working on now. And health benefits. More work should be done on looking at some of the benefits of geologic materials. And then this is a review again, the routes of exposure, inhalation, ingestion, dermal contact, mining issues affecting a range of different occupations. Now, what I'm going to talk about next is questions that came up from the former conference, or I had given this presentation at one of the previous student conferences. And these are questions that came up from the organizers and some from the audience participating. What are the key terminologies or concepts that need to be understood by both geologists and health scientists to improve cross-disciplinary collaboration? Well, several terms are often misunderstood. Geo-availability is the amount of geologic substance that reaches the exposed population. Without geo-availability, there are no problems. Bioaccessibility refers to the fraction of the total amount of a substance that is potentially available for absorption. And bioavailability is the portion of a drug or other substance or trace element which enters the circulation when introduced into the body and is available to have an effect. We need to know the difference between in vivo and in vitro, between morbidity and mortality. And we need to, as geoscientists, understand basic biologic functions, the difference between respiration and inhalation, the function of the major glands in the human body. And we need to recognize the difference, and as biologists and medical science, the difference between element, mineral, and a rock. And I emphasize mineral because mineral, interesting, I think most scientists are clear as to what an element is and what a rock is. But mineral has a vastly different definition of the geoscience community and the public health nutrition community. A mineral to a geoscientist is a naturally occurring material that has a definitive crystal structure and whose chemistry ranges between certain limits. The mineral to public health and to the nutritional community are the essential elements: calcium, sodium, potassium, iron. What we would call elements, they refer to as minerals. So we need to be very clear when we're giving a talk that we define what we mean by a mineral. How can early career researchers ensure clarity when discussing complex field-specific concepts with colleagues from other disciplines? My response is that all things complex can be described in simpler terms. I have never come across a situation that could not be described in simple, easy to understand terms. Don't try to impress your colleagues with your technical sophistication. Do not use sophisticated technical terms. Use plain English. And of course, I use English as the universal scientific language. Educate, explain what you're talking about. Make sure that it's clear. Make sure they understand. What are the most common misunderstandings or assumptions between geo and health scientists and how can we effectively be effectively addressed? Well, physicians focus on healing. Public health researchers and medical geologists focus on prevention. Be realistic. There's enormous funding support for communicative disease such as AIDS and flu and COVID, diabetes, heart disease, cancer, but only modest funding for prevention. We need to emphasize the number of people whose health is impacted by geologic processes and materials. Very often, that now is far in excess of people who are suffering from communicative diseases. And again, we need to be sure we're clear when we talk about elements, minerals, and rocks. Are there strategies or frameworks that early career researchers can use to create shared language and understanding in their interdisciplinary research? And yeah, as I've emphasized, use plain language initially, and once you reach a common level of understanding, you can use more technical jargon. Offer to translate relevant geoscience papers. Google Scholar be an excellent source for I'm sorry, I skipped it. How can early career researchers encourage openness to interdisciplinary communication with their own teams and researchers? We could share relevant papers from other disciplines. The abstract, the introduction, and the conclusion are usually understandable. And Google Scholar, as I said, would be an excellent source. Several of the previous participants expressed interest in learning more about effective communication with policymakers and stakeholders. And many early career researchers are intimidated by the prospect of engaging with these groups and are unsure how to make their research accessible and compelling. If possible, we should be grateful if you can incorporate insights on this topic as well. So these are some of my responses. How can early career researchers effectively communicate their research in ways that engage policymakers? What are strategies might help overcome intimidation? How can early career researchers make complex scientific findings relevant? What are some of the effective ways to convey the social and policy implications of geohealth research? And how should early career researchers handle situations when there's limited interest from policymakers? Well, we need to make sure our talks are well understood. We need to practice to be sure that the talk is given smoothly, and initially you want to practice with a friendly audience. You certainly want to participate in public health conferences and conferences dealing with water quality, air pollution, etc. Volunteer to give a presentation and engage with the speakers and other attendees. What are strategies that might help overcome intimidation? This comes with experience and practicing initially to talk with your colleagues. Remember, you did the research. You are the expert on this topic. Don't be defensive. Welcome reasonable comments or criticism. And often commonly repeated advice: picture your audience naked. That should settle you down. Okay, how can early career researchers make complex scientific findings relevant and accessible to non-scientific stakeholders? Publishing in general scientific journals rather than exclusively medical geology journals will reach a larger audience. Participate in general conferences. With permission from your organization, speak to reporters. The information will get out to newspapers or on TV and reach much, much larger audiences. Volunteer to give non-technical talks to any interested groups, and contact the relevant NGOs, non-government organizations. They also reach much larger audiences. What are some effective ways to convey the social and policy implications of geohealth research to encourage shareholder investment? We need to emphasize the insignificant cost of training and education. We need to point out the reduced healthcare cost. That could be significant. Not only reduced cost for individuals, but for the government as well. We need to point out the increase in productivity of a healthy population. And for politicians, we need to emphasize the goodwill of the people, particularly politicians that are running for office. If they are viewed as trying to improve the health and well-being of their constituents, that should be highly beneficial. Be creative. Create not only to publish in geoscience journals, but creating films for YouTube videos. And we'll be showing one later in the conference. Newspaper articles, radio interviews, distributing leaflets, talking to the public. All of these techniques will spread the word, will bring you more into contact directly with those people who will benefit from the research that you're doing. How should early career researchers handle situations where there is limited interest from policymakers or when scientific findings challenge existing policies? Well, again, we need to collaborate with public health researchers. They may have more connections with the funding agencies or with non-government organizations. They can approach funding agencies from a different perspective. And most importantly, don't give up. Keep trying. And as I mentioned, we'll show a little bit tomorrow, I believe, Black Snow. It's a film that puts a human face to an all too common medical geology, environmental health problem that impacts millions of people globally. This film that hopefully you'll join us to see has been viewed at a dozen or more different venues and has won awards and viewed by thousands and thousands of people that we wouldn't ordinarily reach. Should we continue to speak to the initiated, to our scientific colleagues? We're reaching out to the people who are impacted by this and who may very well be be interested in supporting the kind of research that you're doing. Should we develop a practical dictionary containing useful medical, geoscience, and chemistry terms? This was asked by the audience. The dictionary would be posted on a website of the relevant organizations and made freely available. Certainly welcome your thoughts. And I have a request. As I mentioned, 2019, I returned to India, to the Jahari region, and we looked at the coal fires in that region and found, collaborated with colleagues from the Birla Institute of Technology. We found enormous amounts of fluorine being emitted from these underground coal fires. And I'm looking for a medical doctor, or public health scientist or a dentist to determine the levels of dental fluorosis in the region. So if anyone knows appropriate contact, I would appreciate your passing that information along to me. Thank you very much. I appreciate your patience, and I welcome your comments and questions.
Oh, wow, it was really very nice presentation. So many things we learned. It's great. Definitely, the students have learned the heart of medical geology and the challenges in front of them and how we can spread it to the people around the world, to the communities which are not directly related to geology. But yes, I really like that. We have to reach to people instead of waiting for people to come to us.
Agreed.
Now, the forum is open for questions and answers. I will request all the participants to take advantage of this really massive opportunity. You can interact with Professor Finkelman. You can ask them your queries, doubts, maybe some suggestions. He's there to help you out.
Yes.
You can also post your questions in the chat box and I can read it for Professor Finkelman, sir.
Or if you don't have an opportunity, feel free to email me, BOBF, Bob F, at utdallas.edu. How can a geoscientist tackle some of these medical issues? There are so many issues. Again, there are issues related to trace element exposure, toxic element, arsenic, mercury, lead, selenium, fluorine, and the list goes on and on. There are occupational issues, miners, factory workers, farmers. There are issues related to eating. As I pointed out, there is an abundance of issues. They're not difficult to find, and I think most geoscientists, with the skills that we have, with our expertise, analytical capability, there is ample opportunity to contribute to addressing these issues. Looking at the medical geology literature, there are now more than 40 books on the subject and proceedings volumes, journal issues. It's relatively easy to identify problems and find problems that are relevant to where you live, to where your family lives. Enough scope for.
There is a question. How do anthropogenic modifications like mining and industrialization, alter the geochemical baseline and thus change the geopharmaceutical potential of local minerals.
Boy, that's a lot. Um,
Yeah,
let
I'll
me,
read it again, sir.
yeah, I'm trying to find it. Okay, now please. Oh, okay, wait. How do anthropogenic modifications alter geochemical baseline and change the uh, well, to simplify the response, uh, mining uh, and all the industrial activities modify the natural geologic materials, like coal mining, for example, uh, exposes people to pyrite dust, which results in black lung disease. The acid mine drainage mobilizes arsenic and selenium and mercury and lead and exposes people downriver to these uh, potentially toxic increased. So anthropogenic modifications certainly, one of the biggest is uh, exposure to asbestos. Mining of clay minerals often are associated with asbestos, and the exposure, the inhalation of the asbestos leads to issues such as asbestosis, mesothelioma, lung cancer. So there's an infinite uh, ways that anthropogenic modifications can lead to a range of medical geology issues, but we can't ignore the natural environment. There are places where the natural environment is indeed dangerous to human health, and geochemical mapping is necessary to identify these issues. Are there, this question, um, is there enough scope for startups involving collaboration of geoscientists with environmentalists or public health workers? Yes, the simple answer to the question. We, though, as geoscientists, have to be proactive. It's rare that the environmentalists and the public health researchers will come to us. We need to be proactive. And let me give you an example. I studied a problem in Europe called Balkan endemic nephropathy, and it's a degenerative kidney disease. And what we found was that it was apparently related to organic compounds in the drinking water, because the water was in contact with low rank coals. Well, when I looked at this issue in the United States, I found the same situation where in parts of state where I live, Texas, water was in contact with the low rank coals, and the proportion of people with kidney disease was extremely high. The medical community wasn't aware of this. So I brought this to the attention of nephrologists and medical community, and now we're collaborating on this issue. So at this stage, I have to admit that geoscientists need to be proactive. And when you suspect uh, an issue, when you believe there's a medical geology issue, try to engage hydrologists, the public health scientists, to collaborate with you and to give credibility to this issue. And, yeah. Ah, Yeah, I think it's been widely demonstrated that homes built over granitic terrain are at risk for um, radiation exposure. I think the last statistic that I saw was in England, 20,000 deaths were attributed to lung cancer from radon, and a similar amount in the United States. Uh, Ventilation is a very simple, and for, as I've said, many medical geology issues, there are simple solutions. Ventilation, making sure the house, or in many cases, the basement, is well ventilated, monitoring to determine the levels of radioactivity uh, is certainly valuable. Miners often are exposed to dangerous levels of radon. Yeah, this is an important medical geology issue. However, one of the points that I made is our responsibility to educate. The New York Times and British Medical Association raised the question of whether the granite countertops that's installed in kitchens and in bathrooms, is that dangerous? Is granite, as we acknowledge, some of the highest levels of uranium, thorium, potassium, and radioactivity? Is that dangerous? A colleague of mine did a simple calculation and concluded that a person would have to sleep naked on the countertop for 20 years before they received a sufficiently high dose of radiation. And obviously, conclusion is that if you're sleeping naked on a countertop, you have other problems worse than the radiation. So our responsibility is to educate the public and say, no, the radiation from these countertops is not a threat to your health. That's an important role of our discipline, not only recognizing problems and trying to solve them, but acknowledging when there is not a problem and that the public shouldn't concern themselves. Okay, let me. Yeah. How do terminology gaps influence collaborative research outcomes? Well, primarily they influence the outcomes by preventing them, by not being able to communicate properly with the public health researchers. It's the public health researchers that have the credibility, as there are 3 or 4 geoscientists that also have medical degrees. So for most of us, for the vast majority of geoscientists, of chemists, we need to collaborate with the public health researchers to have the credibility that the public, or that the medical community, that the politicians would accept. And it's otherwise, we're simply talking to fellow geoscientists, and the solutions never get beyond our small community. What trace element balance is most overlooked in medical geology? Um, that's an interesting question. I have not, certainly, from one perspective, I'd have to say arsenic. Arsenic is the element that potentially impacts the health of more people than any other element. In India, in Bangladesh, and China, Europe, Africa, United States, Mexico, uh, there's hundreds of millions of people who uh, are potentially exposed to arsenic. I'd have to put that as the number one. But there are many other elements that are almost as dangerous. How did the idea of medical geology come to my mind? It was from a colleague, a friend from China, visited my laboratory at the U.S. Geological Survey. And I was a coal scientist. As I said, I've been working on coal for 50 years, analyzing coal, determining the trace element concentrations. And Zheng Baoshan knocked on my door one day and he said, "May I show you something?" And he sat down and had a loose leaf book. And he opened the book, and there was page after page after page of people who were suffering from arsenic poisoning, from fluorosis, dental and skeletal fluorosis, from selenium poisoning, from mercury exposure. And he said all of this was due to burning coal. And I was amazed, and I said, I have to see this. I have to confirm this. I spoke with my management at the USGS, and they agreed. They allowed me to visit the Guizhou province, China, with Uli Salinas and Jose. Well, Uli wasn't there at the time, Jose. And when we saw what this geologic material was, how it was impacting thousands and thousands of people, we committed ourselves to spreading the word, trying to prevent this from happening. And then I met Uli Salinas, and he brought in the organization that ultimately became medical geology.
So there is this one question. Uh, Also, moving forward, what can early career researchers do for the growth of this field? Because currently this subject is taught in very limited areas.
Yes, I agree. That's unfortunate. But it is growing, obviously. A good turnout for this conference. We've had uh, three others, and we'll continue. Uh, let me diverge for a moment. This conference has been, in my opinion, so successful, so well run, so well organized, that there must be, I hate to create more work, but there should be additional conferences in South Asia, perhaps every two, maybe every 3 years, because there's always new students, always new interests, new problems. And this is when I worked for the Geological Survey, I didn't realize this because I worked with my college for 30 years, the same people. But when I affiliated with the university, every year there's new people, new opportunities to educate. Um, I think the solution is to broaden our exposure for geoscientists to go out and like what, I don't know if you're familiar with Johnny Appleseed, spread the seeds of medical geology, attend other conferences, hydrology conferences, public health conferences, and so forth, general science conferences, spread the word. In 2005, I believe, was the first medical geology book that we produced. Since then, there's been 40 books uh, produced on medical geology, and including several by your colleagues in India. Excellent book on medical geology for beginners. So it is catching on, and it takes time. We need to be patient but proactive. Any other questions?
Yes, sir. There are some in the chat box. I will read it for you. Yes, sir.
Okay, elevated levels of neurotoxicity. Um, yes. Um, Let me diverge from that for a related issue. Naturally occurring elements that impact neurotoxicity. A student at a university just a few miles from where I live now wrote a paper on lithium. He was able to demonstrate that naturally occurring lithium in groundwater, where it was relatively high, suicide rates of students was low. Where the lithium content was low, suicide rates were high. And this made medical sense. Lithium is used as medicine for addressing mental health problems. So the natural environment is also influences the mental health. So yeah, I mean, not only are geologic materials and we Avadura, the Indian medicine, recognized this problem or this potential thousands and thousands of years ago. The natural environment not only can impact physical health, but mental health as well. And I think this is an area that deserves more attention. Oh, write email in the chat box. Let me see if I. Okay. Yeah, please don't hesitate. If you have additional questions, if I didn't answer your question, send me
Sir,
an email.
There is this one question that if we can have. Can medical geology sustain for a longer duration if we introduce it in the master's program?
Absolutely. Absolutely. Yeah, there's been a number of efforts to create or develop medical geology programs. The one that seems to have taken root is in Nigeria. There is a medical in the university in Kefe, Nigeria. There's a medical geology program that now has more than 20 students registered for both the master's and PhD levels. There are other programs around. India has one of the more aggressive medical geology activities. In the United States, it's has not taken root as well. And the reason for it is medical geology issues impacts rural people far more than uh, urban. Uh, and of course, it does affect urban populations, but it is the rural people who live off the land, who grow their crops locally, who the milk, the meat, the eggs that they eat is local. The water they drink is groundwater. So it is these rural populations that are most exposed to medical geology issues. That's what our Environmental Protection Agency would call maximally exposed individuals. So, where I see the potential for growth would be in countries, the African continent, South Asia, China, where there are significant rural populations where people are more likely to be exposed to the natural environment. So that is where I expect the growth, not in Canada, the United States, or Western Europe, but in India, China, Africa, and parts of South America. Yeah.
There is one more question. Uh, how can interdisciplinary teams develop shared vocabulary that can be accessible to communities that are affected by various environmental hazards?
Hmm. It's an interesting question, how to communicate. Uh, I had the good fortune of living in South Africa for several months. And what I did, I looked for local meetings, local communities, and gave talks to the general public. I, of course, gave talks to universities, but that's limited in reaching the people who are most affected. One of the most effective methods for communicating was something that was done in South Africa. It was called Basa Majengo Magogo. That in the local language, that means how Grandma Magogo burns her coal. And what they did was they came to the village, they brought a band, played music, and the people came to the village center. And they demonstrated that by burning the coal, the people were burning coal in braziers, and burning the coal from the top was much more it was healthier than burning it from the bottom because the pollutants sank into the coal, the ash, rather than coming out. And they found a year later that 90% of the people in the community were now using a much safer way of burning coal. So they communicated with the language uh, of the local people and a very effective way of minimizing the uh, medical geology issue. We need to do more of that. We need to go to the communities that are affected and speak with the people in terms that they can understand.
So we have,
How are we with time?
yeah. So maybe we can have like last one and two questions, maybe more. Is that okay with you?
Yeah, it's just about time for me to wake up. So
Yes, yes, sir. Okay. Sir, could you please elaborate on how to bridge the vocabulary and communication gap between scientists and policymakers while conveying geogenic health risks?
okay, yes, I think I alluded to this. The policymakers, you have to speak in terms that they're interested in, not geoscience terms, not medical terms, but how could they benefit? How could a policymaker benefit from your research? So you have to point out how many of his constituents are affected by this issue. How many of their constituents can you save? Can you save their lives? Can you save them money? Can you improve their health? Can you make their constituents more thankful to the policymaker? Can you save money? Can you show how much money you'll save by um, preventing the problem, by saving lives, by avoiding medical costs, by improving productivity? These are the kinds of terms that they understand, not parts per million or ICP or these technical terms. They want to know how your insights will benefit them. So you need to think in those terms and not, hey, I've done some very sophisticated geoscience work, but my work can benefit you. And here's how my observations can improve the life of your constituents.
Thank you so much, sir. We have, I think,
I think it's 9 o'clock.
yes, yes, we should,
Yeah.
yes, sir. So,
Well, I want to thank everybody. I appreciate you many good questions, really thought-provoking questions. And again, I emphasize if you have any additional questions, please don't hesitate to send them to bobf@utdallas.edu. I'd be pleased to hear from you. Thank you.
I will now request Conference Chair, Professor Randive, sir, for his comment.
Oh, thank you, Pratik. Although I missed the morning session, but then it has been very engrossing, and uh, sitting here on this chair, it looks that we really